for joining us for this week's episode of Mommy Talks with me, Catherine Karong'o. This week we discuss secondary infertility, a condition that affects many couples who have gone through the first pregnancy but are unable to get pregnant again. Joining us is Dr. Raj Dodia, a gynecologist at the MP Shah Hospital, to discuss this further. Let's start with the definition of what secondary infertility is.
Secondary infertility is basically when a couple has had children or pregnancies previously but are now finding it difficult to get pregnant again. Usually in women who are in the reproductive age group, delays up to a year, even 2 years, right? And that is considered normal. Up to 80% of women, 85 actually, get pregnant within the first year, and this goes up to 90 to 95% in the second year if everything is normal. Secondary subfertility, I call it subfertility because infertility gives us a notion of that the couple cannot get pregnant. I prefer using subfertility. It gives us an element of hope that they will get pregnant. It's just a reduction of fertility, not fertile at all.
At what point is a couple told that, yeah, now you have secondary subfertility?
So Catherine, what we've recognized is when you wait up to 2 years without getting pregnant, then you're to a certain extent labeled subfertile. When you're when the woman or the mother is over the age of 35, we usually wait less because we know time is not on her side. And therefore we usually wait up to a year after that before we start doing the necessary investigations and treatment for the potential causes of secondary subfertility.
What are the causes?
So there's a list of them actually, and this is one list where the men go first. So I'll start with the men. So usually there's sperm problems, right? So when it comes to sperm problems, there's the diet and lifestyle of the man, there's the problems producing the sperm, and there's the problems in delivering the sperm, right? So that's the men bit. Then comes the women bit, and there's a list of them. Endometriosis is a fairly common situation and condition that we see nowadays. 1 in 9 women have confirmed or unconfirmed endometriosis. This is known to reduce your fertility. So in secondary subfertility, after you've had your first child, you may have had mild endometriosis at the time when you had your first child or previous children, and thereafter the disease worsened and progressed, and therefore it may affect getting pregnant again. There's fibroids. Fibroids, up to 80 to 85% of the women walking around the streets of Nairobi have fibroids, and yet they don't know because majority of the time there is no symptoms. There are no symptoms to that particular condition. However, fibroids can cause subfertility because they can cause blockage. They can prevent the fertilized ovum from implanting properly in the uterus as well. Then there's surgery. When patients undergo surgery, especially in their abdominal region, right? The body tries to heal by itself, so it forms scar tissue. So scar tissue inside the abdomen is called adhesions. So adhesions can cause things stick to each other, and when they stick to each other, they can cause mechanical problems, preventing the egg from getting into the fallopian tube, or even the patency of the fallopian tube being compromised.
And the surgery includes a CS?
Yes, at times surgeries such as cesarean section may also reduce chances of getting pregnant later on. Usually not, but there is a possibility. Cancer nowadays, we're picking up cancer earlier, and arguably there's more cancer around as well. So when we treat cancer with chemo or chemotherapy, which means putting in drugs, or radiation, where you're exposed to radiation to help against the particular cancer, this can cause architectural changes within the system, the reproductive system, and this can cause delays in getting pregnant again. Development of autoimmune disorders, rheumatoid arthritis, there's something called lupus. This can affect getting pregnant again, right? There's certain medications that you can have that prevent you from getting pregnant again. right? Drastic weight changes we've noticed. Women who go on these binge diets and they lose lots and lots of body fat in a very short period of time. You may have noticed their periods disappear, they have problems with their hormonal cycles, and this automatically causes problems in getting pregnant.
So we should not go on those diets that promise you lose weight 2 weeks.
No, not at all. I think medically and for your hormonal cycle, it's not a good idea. What we've noticed is at the fastest rate, if you lose half a kilo a week, your body seems to adapt to the change a lot more quicker, and it's less likely to cause hormonal imbalance. There's something called premature menopause. Premature menopause is when you're younger than 40 years of age and you start getting signs and symptoms of menopause. Hot flushes, dryness, lots of UTIs, mood changes and disorders. These are all signs that your ovaries may already have stopped producing the hormones that it usually does in a cyclical fashion. And this is termed as premature menopause. It requires a laboratory diagnosis, and this of course means that you cannot get pregnant. Age, this is something that's very important that we need to discuss. So what we've recognized in the medical field is that the older you get, the lesser the quality of the eggs that your ovaries produce, right? And what we've recognized is after the age of 30, the chances of miscarriages in the first trimester increase, and after 35 they increase exponentially. And this is because of the quality of your eggs, right? So the longer you wait to get pregnant, the higher the possibility that it may take longer for you to get pregnant, and if you do as well, there's a higher chance/stroke possibility that you may have a miscarriage. Stress and insomnia, especially in our city like Nairobi, we need to recognize that constant and chronic stress can cause hormonal imbalances. Right? This can also lead to insomnia, which is essentially not sleeping very well. The chronic stress we've seen, especially in the past few months, has been quite significant in terms of the hormonal cycles of many of our patients. The women come in and complain that they haven't had their periods, they've had periods that are too long, they've had their periods at a very short time period again, they've had their periods twice a month or even 3 times because they're bleeding. Of course, you need to rule out medical causes, but when those are ruled out, we've recognized it's chronic stress that has been caused by the current conditions that has resulted into hormonal imbalance. Lifestyle, getting into lifestyle, we've noticed dietary factors, diet and lifestyle changes. So the easy and fast access to junk food means you're not getting enough nutrition, right? And the very fact that we talk about fast food / junk food means we're eating while we're standing, we're not allowing digestion to occur properly, we're not getting the necessary nutrients that we should from our food. And this all definitely impacts our hormonal cycles. And obviously this impacts in how fast and how quickly we can get pregnant again, right? And the last one is unexplained. We don't know. If everything is fine, all the architecture is fine, the man is fine, the hormonal cycles are fine, she's good young age and everything's working properly, you still may get secondary subfertility or delays in getting pregnant again, but we don't know why. Yeah.
So what do you do in such cases?
In such cases, we move on. So we need to ensure that the investigations are complete. This may also involve and include looking inside your abdomen to make sure there's no undiagnosed endometriosis. There's also, at that point in time, we push dye in from the cervix to make sure that the fallopian tubes are patent, right? And this essentially helps in many of the cases to diagnose, and if not, then to a certain extent treat this subfertility.
Is there anything a couple can do to avoid getting secondary subfertility?
So with all the potential causes that we've talked about, right? If you can avoid some of the avoidable ones that we've talked about, right? We've talked about the diet, we talked about the stress and the lifestyle. There's not much else that we can actually do to avoid subfertility. It's more of a diagnosis of looking back and saying, oh, okay, you've been trying for 2 years now. Maybe there's something wrong. We're not sure what it is. Let's get this tested, this tested, this tested, this tested. So there's nothing you can do per se, which is 100% confirmed that will prevent subfertility. Right? Well, the factors that are in your control we've just discussed.
How common is it? Do you see a lot of these cases, and how do the national statistics look like?
Oh, that's a very good question. Kenya as a whole, we don't have a database, right, of secondary subfertility. So I'm not in a position to quote national statistics for you. In terms of how common it is, I just told you I saw 2 patients yesterday with this particular condition. I don't know how many other private practitioners out there, or hospitals for that matter out there, are seeing this. But what I do know is it's getting a lot more prevalent. We're waiting longer to get pregnant, which means you're more likely for endometriosis and or fibroids to progress in their disease process and therefore cause problems later on. Our diets, not really the best, getting worse actually day by day, unfortunately. Obesity is something that I did not mention that I think is an avoidable risk factor, right? We talked about drastic weight changes in a short period of time, but even obesity per se can cause problems. This is something we can control.
When you diagnose that someone has secondary infertility, yes, is there a way you can treat and they're able to conceive again?
Yes. So the trick and the key is to diagnose what is causing the secondary subfertility, right? And once you eliminate that particular factor, you can definitely ensure that this patient is going to be fertile and will get pregnant again. The most positive thing about secondary subfertility is that these are couples who have been pregnant before, right? And there's very much going for them. There's a lot of hope and positivity that if we remove the offending factor, they're highly, highly likely to get pregnant again.
So there is no specific treatment. It has to be diagnosed, the cause, and then you treat the cause.
That's the way I do it. I don't shoot in the dark. I need to know what's happening with that particular patient and attend to that particular problem before we can go on to the next.
At what point do you say now we give up?
So that's a very good question. Again, we need to ensure we've done all the necessary investigations, rule out all the major and most likely causes of secondary subfertility. And at the same time, we need to keep in mind how long we're going on, right? So we can take 6 months, even up to a year investigating these couples. And at the same time, they're still trying for their baby, okay? And after a month, after 6 months or a year, and ensuring that we're still within the time period when she's still fertile, if we still haven't found a diagnosis and if they still haven't gotten pregnant, we usually pass them on to fertility experts so that they can do their necessary further treatments.
Thank you so much. What would be your last word of advice for couples who may be going through this?
My piece of advice for secondary subfertility is don't wait too long. Many times, as you've noticed, there's so many factors that we can investigate and diagnose for which we can do something about, and therefore don't wait too long. After a year and a half of having tried, if you still haven't gotten pregnant again, please come over. We'll have a chat. We'll find out what are the potential causes in your particular case, and then we'll move on from there.
Thank you for staying with us. We really appreciate your support. If you've not subscribed to the channel, please subscribe using the subscribe button below. You could also ring the bell to get notifications whenever we upload new content. Join us again next week for yet another insightful episode where we talk about delayed milestones in a child. Until then, stay safe and goodbye.